So here's a coaching video for exercises that are designed to increase range of motion of your rib cage. First one we're going to do is axial extension. So we need a flat surface to lean up against, and I'm going to use this door over here. You can use a wall, you can use a door, whatever you choose to use. If you use a door, make sure nobody comes on the other side of it. That'd be bad. Okay, so I've got a secure door here. I'm going to put my feet about 1 foot length away from the bottom of the door. I'm going to bend my knees a little bit. My shins are going to be more or less vertical. It's not a big deal in that regard. And I'm going to do a two-part maneuver. First part is a pelvic tilt, a posterior pelvic tilt. If you haven't done one before, you can practice it lying down. It's a lot easier to do it there. I'm going to use my stomach muscles to pull the front of my pelvis up to the ceiling, and I'm going to maintain a tall posture while I do it. That's going to take my low back and move it close to the wall, maybe make a touch. Here we go. Pulling upward with my stomach muscles, contracting a bit with my backside muscles, but I'd rather you use more your stomach muscles. They're a little better to train, do you more good for this application. My back is now able to touch the wall. By that I mean this part of my back, the hollow, the part that usually has a curve in it. Not everybody will be able to do this. Some people will never be able to do it, they'll just get better at it. Some people won't be able to do it at the beginning, but they'll get better at it and they'll be able to do it. It's important that you know what your effort is doing in terms of movement. So if you can't get your low back to touch the wall, put a sponge or something soft and squishy in there so that you can feel the change of your spinal posture as you make your effort. This takes some coaching sometimes and some dialogue between you and your therapist to get it right, but it's a very helpful thing when you do. Here we go. Part one is now done. Pulling upward on my pelvis, on the front of my pelvis, my low back is against the wall. Part two, looking straight ahead, shoulders are relaxed. I'm going to direct my head backward in space. I'm going to endeavor to get my head, the bottom third of it back here, to touch the wall. This is hard to do for a lot of folks. So again, you get something soft, like a soft pillow or a big sponge, and you're going to put it between your head and the wall so you can feel the result of your effort and feel the head moving in space. This is tricky to do. Again, you get lots of coaching and help from your therapist. My low back is flat. I have to maintain that effort in that end position while I do this. Relax my shoulders and ease my head toward the door. If you think your objective is to get your head to touch the wall, you might do that because you can use the long dimension of your head to accomplish that goal. That's not helping you in the way that we want to help you here. Keep your chin level. Then the way that your head will approach that door is that your upper back curve will flatten out. And you'll be able to make your spine longer. And you'll be able to reduce the curve between your shoulder blades. And you'll have figured out how to make the muscles work that make your spine tall. There's a lot of benefit to that because modern lifestyles don't ask those things of us very often, so we lose them. There's consequences to that. So here we go. Ready? Pelvis is back, low back is back, shoulders are relaxed, head is easing to the wall. Remember, you take your feet away from the wall, it makes it easier to do. If you want to challenge yourself, well then you put your feet closer to the wall and you make your legs a little more straight. That does something different to the muscles on the front of the waist and the hips that makes it sometimes really challenging. But your therapist will guide you through that. How many of these should you do? Again, your therapist will guide you through that. 5 to 10 I often prescribe, but it depends on the life circumstances and such. How long do you hold it? Because the throat gets closed off a little bit, especially if you're not used to it, I don't have people hold it all that long. Get specific directions from the person working with you, but a couple seconds, 3 seconds or so, that's what you do. Moving on. The next exercises are all done sitting down, because when you sit down, you can make the movement happen from your rib cage more, because your hips can't contribute to the motion as easily because you're not on your legs and your pelvis is fixed on this seat. Let's do rotation. Broomstick, okay. Two ways to hold the broomstick. If your front of your shoulders are comfortable and your therapist says this is a good idea, you take your stick, and I'm going to show you from the side so you can see. You do that tall posture. You make yourself feel like you did when you're against the wall, to the extent you can. And then you take your hands and put them over your elbows. You raise up. You bring your shoulder blades together. My hands are over my elbows. And then the stick descends down behind your head up to the upper back, which is hard to do. And you don't want to accomplish it by doing that. That's not good. You have to maintain that tall posture. And then you're like this, and there's your starting position for your rotation. If that's not well suited to you, then you cross your arms like this and you hold the stick like that. And having the stick here is kind of nice because people can use the end of the stick with things that are around the room to landmark how far they go with their rotation. I'm going to sit off center here so you can see where I end up once I start. My head is straight ahead and my chest is straight ahead, my legs are straight ahead, and I'm going to rotate my head and my chest as a unit. How far do I go? Talk to your therapist again. Generally speaking, you've got a reference point of the first point of feeling some stiffness. If it's really sore, you stop just short of that. If it's moderately sore, you go up to it. If it's not too sore and you're trying to squeeze out some more function and some more capability, you go past it. You get guidance from the person working with you. Tall posture. Don't shrug your shoulders. I hope I didn't do that. Rotating. I'm going to go to the first point of feeling a pull. So there's where I feel some pull. I'm going to breathe in, and I'm going to, when I breathe out, my bones are going to relax. My bones are going to be able to move more because there's no air in my lungs, not much. And I can twist as I breathe out. When I breathe in, I'm going to allow myself to go back to my starting position, but not the whole way. And then when I breathe out, maybe the point at which I feel the stiffness will be a half a degree or a degree more than the first repetition. That'd be good. Breathe in. Exhale. Maybe this one will be a degree or two more than the second one. And on and on. How many repetitions do you do of this exercise? Talk to your therapist. They'll give you the specific number for your state. I often tell people to go repeatedly until they find they do like 3 repetitions and they don't think they're changing much. Then you've probably done as much as your body can adapt to at that moment, and you'll do it again that day sometime, or maybe the next day, depending on the instructions that specific person needs to have. That's it. That's how you do rotation. And then the opposite rotation is the simple mirror image of that. Do you go from here to here? There are some circumstances where that's prescribed. When it's a sensitive condition, I usually don't. When a person's getting ready for athletics, I might. So that's that. Now, another one that combines rotation with side bending. Let's speak about side bending. Side bending. Got this wrapped up like this, and what you do to get a side bending, I'm going to side bend right. I'm going to shift my upper body to the left, and then I'm going to tip myself down toward the right. You can use breathing just like you did the last one. Breathing in, exhaling, shift and tip. Breathe in. Shift to the left and tip to the right. If this goes well, you'll feel your effort in your rib cage, not necessarily your low back. Although it could happen there if that's a real sensitive spot. Talk to your therapist. Breathe in. Tip out. Tip over to the left and down. What do you do for the other side? Mirror image. The combined movement here is kind of like paddling, but not quite paddling. Well, I don't know, I don't paddle. But if I did, I kind of think this is what it would look like. You'd start with the bar in front of you like this, I'm going to push the bar with my right hand up to the left. That has bent me to my right a little bit. Now I'm not done. I'll show you from this angle so you can see what I'm going to do next. I'm going to breathe out and rotate. I'm going to breathe in and come back to a center position, not full center, but partly. Breathe out and rotate. So I have a combined movement here. I'm bending to the right, twisting to the left. You're noticing I'm using exhalation type patterns like I did for the previous ones. When you're trying to get a rib cage moving, breathing matters. And pay attention to your left foot when you do this one. Don't let it sneak up onto its outer edge. Keep it planted flat. Other side is just the mirror image. Like that. Here's a slightly different maneuver that looks similar, but it's got a little difference. I'm going to take my right hand and I'm going to put it up and over. That's my first move. Now that's bent me to my left. I'm bent to my left a little bit. Now I'm going to impose a rotation to the left also. So I'm side bending and rotating in the same direction. There we go. And there we go. My feet are flat. Breathing in. Exhaling. Breathing in and allow yourself to come to the center, but not full center. Exhaling and allowing yourself to, or making the effort, to go into the movement further. Cycle through that. So, keep your feet flat. Exhale. Go into the stiffness based on the comfort guidelines you've been given by the person who's walking you through their stages of recovery. Keep your spine tall, okay? Don't let it go super sideways. You're always trying to get the crown of your head to the ceiling as you're doing and posing these other things on top of it. If you find that the arm on top with this exercise or the previous exercise is starting to get a little bit aggravating, your therapist might tell you to break your repetitions into smaller ones at a time so you can rest your arm. It's easier to relax when you're comfortable. There you go. And another one is bending your upper back backward. I don't always teach this one because it's kind of hard to do. It's technically difficult to do. But if I want to get my rib cage to bend backward in the area between my shoulder blades, then I want to hold my neck still. So I'm going to use my hand to do that. My index finger is going to go under my jaw. My thumb's going to go on my collarbone. I'm going to do the same thing on the other side. And that's going to hold my neck still. See, I got my elbows together, not choking myself though. Got my hands touching, depending on the size of your hands relative to your neck. So now I'm going to tip forward. And now, once I tip forward, I'm going to raise my elbows up. And again, you can exhale when you want your rib cage to change its shape. Less air in it, it changes its shape better. Here we go. Tipping forward. Now, tipping my elbows up, breathing in, exhaling, elbows up. Breathing in, exhaling, elbows up. And I'm tipping forward, I'm leaning forward as I'm putting my elbows up. And that's going to cause my axis, the point at which I spin around, to be more up here. If I don't do that, and I do this, where I haven't leaned forward first, the axis is probably going to wind up around my low back. And so the point of this coaching is to get more movement out of the rib cage. I hope that helps. Good luck to you.